The 6 minutes walking test is a self-paced test of walking capacity. The distance walked is the primary test outcome. Patients are asked to walk as far as possible in 6 minutes along a flat corridor. A patient is required to walk a 30-meter course around 2 cones. The SpO2 and heart rate are measured continuously during testing. Dyspnea and subjective fatigue are measured before and after the 6 minutes walking test using validated measurement scales such as the Borg scale. The 6 minutes walking test is a reliable measure of exercise performance and functional capacity across various lung diseases. The distance walked is inversely related to risk of hospitalization in chronic respiratory disease and mortality in COPD. The Incremental Shuttle walk test is a test of maximal exercise capacity. A patient is required to walk a 10-meter course around 2 cones that are spaced 9 meters apart. Walking starts at a slow pace and then increases incrementally when the patient hears an audio signal at 1-minute intervals. The walking continues until one or more of the following occur. The patient is unable to continue. This is determined by either the patient or the operator. The patient does not reach a cone before the beep sounding, or the SpO2 falls to less than 80%. The distance walked is the most important test outcome. The Endurance Shuttle walk test is performed by walking for as long as possible to a maximum of 20 minutes at a predetermined percentage of the maximal walking performance as measured by the Incremental Shuttle walk test. Therefore, an Incremental Shuttle walk test must be performed before an Endurance Shuttle walk test. The primary outcome measure of the Endurance Shuttle walk test is the time walked at the predetermined speed based on the Incremental Shuttle walk test performance. All 3 tests are built into the O2matic Pro device.